Hepatitis. Hepatitis is a medical condition which refers to the inflammation of liver. Symptoms. Symptoms includes fatigue, fever, loss of appetite, abdominal pain, joint pain or muscle aches, nausea, vomiting, dark urine, and jaundice. In some cases, hepatitis can progress to serious liver diseases, such as cirrhosis or liver failure and cancer. Causes. The causes of hepatitis includes viral infections, hepatitis A, B, C, D, and E caused by different viruses, that can be transmitted through contaminated food, water, blood, or sexual contact. Heavy alcohol consumption can lead to inflammation of the liver, known as alcoholic hepatitis. Autoimmune disease. Poor hygiene and sanitation can increase the risk of hepatitis A infection, as the virus is often spread through contaminated food or water. Certain medications and toxins can cause hepatitis, such as acetaminophen overdose, exposure to industrial chemicals, prescription drugs or recreational drugs. Types of hepatitis. There are several types of hepatitis, each caused by a different virus, i.e. Hepatitis A, HAV. HAV is usually spread through contaminated food or water. It is most common in areas with poor sanitation and hygiene. Symptoms of HAV typically appear within 2 to 6 weeks of infection and include fatigue, nausea, vomiting, abdominal pain, and jaundice. Hepatitis B, HBV. HBV is spread through contact with infected blood or other bodily fluids, such as through shared needles during drug use or unprotected sexual contact. Symptoms of acute HBV are similar to HAV but can also include joint pain and fever. Hepatitis C, HCV. HCV is also spread through contact with infected blood or other bodily fluids. Most people with acute HCV do not have any symptoms, but some may experience fatigue, nausea, or abdominal pain. Hepatitis D, HDV. HDV is a rare type of hepatitis that only affects people with a prior HBV infection. HDV is also spread through contact with infected blood or other bodily fluids. Hepatitis E, HEV. HEV is spread through contaminated food or water and is most common in areas with poor sanitation and hygiene. Symptoms of HEV are similar to those of HAV and usually go away on their own without treatment. However, HEV can be more severe in pregnant women and people with weakened immune systems. Diagnosis of hepatitis. There are several tests that can be used to diagnose hepatitis, i.e. blood tests can detect the presence of certain antibodies or antigens associated with different types of hepatitis. For example, hepatitis B surface antigen, HBsAg, and hepatitis C antibody, anti-HCV, tests can detect the presence of hepatitis B and C, respectively. Liver function tests, LFTs, measure the levels of certain enzymes and proteins in the blood that are produced by the liver. Abnormal levels of these substances can indicate liver damage or dysfunction. Imaging tests such as ultrasound, CT scan, or MRI can be used to visualize the liver and detect any abnormalities, such as scarring or tumors. In some cases, a liver biopsy may be recommended to confirm a diagnosis of hepatitis and to assess the degree of liver damage. This involves taking a small sample of liver tissue for examination under a microscope. Treatment. There are several drugs available for the treatment of hepatitis, depending on the type and severity of the disease. Interferon. This drug is used to treat chronic hepatitis B and C. It is a protein that helps the body fight viral infections. Interferon can be injected or taken as a pill. Ribavirin. This drug is used in combination with interferon to treat chronic hepatitis C. It can be taken as a pill or inhaled as a powder. Direct-acting antivirals, DAAs. These drugs are used to treat chronic hepatitis C. They target specific proteins in the hepatitis C virus, preventing it from multiplying. Examples of DAAs include sofosbuvir, levetiracetam, and declatosphere. Antiviral drugs. These drugs are used to treat chronic hepatitis B. Examples include entecavir and tenofovir. Immunosuppressants. These drugs are used to treat autoimmune hepatitis. Examples include prednisone and azathioprine. Vaccines available for hepatitis. There are vaccines available for hepatitis A and hepatitis B. The hepatitis A vaccine is a 2-dose series given at least 6 months apart. The vaccine is recommended for people who are at high risk for hepatitis A infection, such as travelers to areas with high rates of hepatitis A and people with chronic liver disease. The vaccine is also recommended for anyone who wants protection against hepatitis A. Hepatitis A vaccine schedule for adults and children over 12 months old is 2 doses of the vaccine are given at least 6 months apart. For children between 6 to 12 months old, a single dose of the vaccine may be given followed by a booster dose at 12 to 23 months of age. The hepatitis B vaccine is a 3-dose series given over a 6-month period. The vaccine is recommended for all infants, children, and adolescents, as well as adults who are at high risk for hepatitis B infection and people who have unprotected sex with multiple partners or have sex with someone who has hepatitis B. For adults and children, a 3-dose series of the vaccine is given over a 6-month period. The second dose is typically given 1 month after the first dose, and the third dose is given 6 months after the first dose. For infants, the first dose is given within 24 hours of birth, followed by 2 additional doses at 1 to 2 months and 6 months of age. Management of hepatitis. Here are some general guidelines for the management of hepatitis. Lifestyle changes may include avoiding alcohol and drugs that can damage the liver, eating a healthy diet, getting regular exercise, and maintaining a healthy weight. There are medications available to treat viral hepatitis and autoimmune hepatitis. These medications should only be prescribed by a healthcare professional. Patients with chronic hepatitis should have regular checkups to monitor their liver function and to detect any changes in the liver. Vaccinations are available for hepatitis A and B. Patients with chronic hepatitis B should also be regularly monitored for signs of liver cancer. In some cases, a liver transplant may be necessary for patients with end-stage liver disease. This involves removing the diseased liver and replacing it with a healthy liver from a donor. Prevention. Preventive measure includes practicing safe sex, avoiding sharing needles or drug equipment, avoiding excessive alcohol consumption, and being cautious when taking medications. Good hygiene and sanitation practices, such as washing hands and using clean water, can also help prevent hepatitis A infection.